If you have ever wondered what it is a doctor is looking for when they examine your sick child, this video may help. And today, actually, I've got my daughter who unfortunately has a viral upper respiratory tract infection at the moment, otherwise known, as a simple cold. So I'm going to run through a few things that I would usually do to check a sick child, and I'll walk you through what each of those steps mean, what we're looking out for, and how we can help your child in terms of symptoms and relief. We would look at the general appearance of the child. Is he or she active and alert? Is there a bluish discoloration or paleness of the skin? Do they have a cough, and what does it sound like? Fever in children. According to the Royal Children's Hospital, Melbourne, a low-grade fever is defined as a temperature between 37.6 and 37.9 degrees Celsius, while a fever is defined as a temperature at or above 38 degrees Celsius. Febrile convulsions occur in 2 to 4% of children under 5 years of age, but they're usually not associated with any sort of neurological or other problems. In fact, it's well established that a fever is not a predictive method of identifying serious illness as much as looking at the overall clinical condition, which is why most doctors tend to use other factors and parts of the examination to guide their judgment on the severity of an illness. The ear examination. Doctors will use an otoscope device to look inside the ear. This examination is not usually uncomfortable or painful. This examination is to check for problems in the ear canal, eardrum, otherwise known as the tympanic membrane, or the middle ear, mainly for signs of an ear infection. The throat. Doctors will also look inside the throat to check for signs of infection. We would look at the tonsils and also maybe feel the glands of the neck. We want to rule out things such as strep throat. The chest. First, we check to see, are they making any sounds while breathing? Are they using any extra muscles to help them breathe? We check the child's breathing rate. A child's normal breathing rate varies by their age. Then we use a stethoscope to listen to the chest, looking out for sounds such as wheezing or crackles. This might help us decide if there is a chest infection, asthma, or other lung condition. We can also make sure there is no tummy pain, and for that we might feel or palpate their abdomen. So, when I'm looking at a child, I'm trying to make sure that there's nothing concerning or a red flag that would lead me to escalate treatment, to potentially ask the child to go to hospital. If there's a high temperature, we can sometimes give medications to help bring it down. That's best to discuss with your doctor. The other thing I look at is, of course, a general check to see, is the child laboring to breathe? Are the muscles being used around the neck and chest? Is there a runny nose? Or is there any conjunctivitis of the eyes, so red inflamed eyes with any discharge? We also look at any rashes, or if the skin appears, pale, blue, mottled. It's always best to seek professional advice when you or someone you care for is unwell.